Hello and welcome to our New Hampshire Point in Time Google Form or non-HMIS training session. My name is Travis Newton. I'm a representative of the Balanced Estate Continuum of Care and also an administrator with the Bureau of Homeless Services. I'm going to be leading you into this training content that was held live on January 14th, 2025. The training itself is intended for anyone who is either entering into HMIS for unsheltered program types such as street outreach, or any entities that do not enter into HMIS at all. HMIS being our Homeless Management Information System. The PIT count date for 2025 is Wednesday, January 22nd, and goes from that evening to the morning after. You're about to view the live recording, which includes representation from all three of New Hampshire's continuums of care, or COCs. Representatives from Greater Nashua, Manchester, and the Balanced Estate were able to come together to review this content and make sure that it is something that feels universally New Hampshire, regardless of where you're based in the state itself. This content will begin with Bobby Bagley from the Greater Nashua Continuum of Care discussing the PIT count background and basics. Thank you.
Good afternoon, everyone, and thank you, Travis. As Travis said, my name is Bobby Bagley. I'm the director for the City of Nashua's Division of Public Health and Community Services and the Chief Public Health Official. I also serve on the Greater Nashua Continuum of Care, and I am the co-chair for our homelessness outreach subcommittee. And I'm going to be covering the point in time count background and the basics, which will give us a good understanding of why we do the point in time count and its purpose. I just need the slide. Thank you. All right, so for many of you that have worked with us before, you may remember what we do with regard to the point in time. And then there may be some folks that are new. And so the point in time count is actually a HUD or the Housing Urban Development Department's mandate of a count of all unsheltered and sheltered individuals that are experiencing homelessness on a single night in January at a given point in time. And in fact, HUD actually started doing the point in time counts back in 1983/84. So it's been over 40 years that we've actually been doing this activity. The point in time count is scheduled during the last 10 days of the month of January. And typically you have communities that are identified, which will include individuals that are of a family unit, single, and unaccompanied youth under the age of 18 or age 18 to 24. The communities also include those of veteran status and those individuals that are chronically homeless. And that is determined by long-term or repeated homelessness and the presence of a disability. So why do we do this count? This is really important information for us to gather so that we have a better understanding of what the homelessness situation looks like in our state. And so we do this to track our national progress towards ending homelessness, also to assist our local systems, our planning, which is our continuum of care, also to inform our public opinion and public awareness, because it allows for us to have data that allows for our communities, our local communities, our geographic communities, and statewide to understand what is happening in our communities with regards to homelessness. And it also allows for us to use the data to get other resources and fundings that will help eradicate homelessness. Our point in time uses data sources, and so we're looking at collecting information from our HMIS, our Housing Management Information Center for sheltered programs. And we have agencies that will enter the information into HMIS for their emergency shelter sites. We also look at places where there's safe haven or transitional housing programs that will also collect the data for those particular project sites. All other agencies and programs are going to be using their Google form or the printable form that we will have. Non-HMIS data collection agencies are going to be those that will enter the data that does not meet the shelter definition and agencies that do not enter HMIS at all, regardless of the program type. So all of us will be collecting some information that will help provide us with the data that we need to help us understand and get a better picture of homelessness in our state. The time frame for our point in time, as Travis mentioned, the date is Wednesday, January 22nd, and it will be from 6 p.m. to Thursday, January 23rd at 6 a.m. And so we will be asking information from those who complete the questionnaires on where they spent the night during that time period, because it is a point in time. Outreach to ask questions, complete the surveys up to 1 week from the start of this date, which will be January 23rd, 6 p.m. But it will only be for the time period specified. So the only information that we want to know is where people spent their night on January 22nd from 6 p.m. until Thursday, January 23rd. Housing status during this period is the only period time counted. And so if our community does not conduct outreach during this time window, you will be asking individuals about their housing status during the above time period only. So what that means is, so for instance, if you're not going to go out to do data collection during that time on January 22nd from 6 p.m. to Thursday 23rd, if you go out during the week or the day after, you're still going to be asking about where the individual spent their time on that particular evening.
Good afternoon, everybody. My name is Owen Westover. I am the project coordinator for the Office of Homelessness Initiatives for the Office of Mayor Rouet for the City of Manchester. I'm also the chair of the Coordinated Entry Subcommittee for the Manchester Continuum of Care. So I'm very happy to be able to have this discussion with you guys. And if you would like to go to the next slide, Travis. So firstly, when approaching somebody who's experiencing homelessness during the PIT count, it's important to start off by introducing yourself and keeping open body language. Firstly, you're going to want to make sure to ask if the person has a few moments just to discuss some of the questions you have. They may have questions surrounding why you're taking the survey. Some people get a little defensive. You just want to disarm it and have the conversation just be open and transparent. Tell them what it's about. On the paper forms, there are lines that do go over and discuss some different key talking points you can use when discussing with folks. But of course, that said, you'll want to keep in mind these folks are experiencing a lot of stress, a lot of mental health conditions, may have an active substance use disorder, and there may be trauma involved with that person. So make sure when talking to them, like I said before, use very open body language. Don't cross your arms, make sure to keep your hands open, make sure that they're seen. You know, I generally like to keep eye contact with folks when I'm having discussion with them, but don't be too intense. You don't want to come off as I guess is the best way with that. But of course, don't sneak up on them, don't wake them up, don't startle them. If somebody's asleep, we have observation counts that'll be gone over separately. And of course, when having that conversation with them, there's a lot of terms that people don't understand, or they might not fully understand what you're talking about. Make sure to be speaking slowly and concisely when just interacting with them. It'll help them understand a little better and make them feel a little more at ease when having that conversation. Travis, if you'd like to go to the next slide. As I said before, explain what's going on. You're going to want to make sure that they agree to what you're discussing, and you want to try to make sure that they fully understand the questions that you're asking, as well as why you're asking them. Your intentions are important. A lot of trust is an essential part of having conversations with the folks who are unsheltered in our community. You know, a lot of service providers, as many of you know, spend a lot of time building trust to be able to gain agreement with those clients when having conversations, even with basic paperwork. So these conversations, especially when asking about sensitive things like their experiences of homelessness, you're going to want to make sure that you're transparent on how you're asking. If they consent to answering your questions, of course, you'll want to continue with the interview. You'll have everything listed in front of you, whether you're using the Google form or if you're using the paper form. If they're not okay with answering any of those questions, or at any point during the interview process they determine that they're not okay with answering questions, that is completely okay and is within their right to decline the further interview. If you'd like to go forward. Use the survey form. You have the paper form. The paper form has a lot of those key talking points on there as well. It'll have a lot of essential pieces of information you'll want to make sure to accurately and legibly write on the paper form. If you're using the Google form, everything will be required and straightforward, which will really be helpful when going through those questions. If there's any specific questions that the survey participants don't want to answer, that's totally fine. They're within their right to decline any answer or any questions that they don't feel comfortable with answering. But just try to complete as much of that survey as possible so that we can get that information and use that when in the background trying to do this count for the most accurate purposes here. And further reiteration, they have the right to refuse this. They do not have to answer any questions that they are not comfortable with. Of course, you're going to want to try to gain their agreement and make sure that they're comfortable asking or answering these questions, but they do not have to. Perfect. Next slide, please. But we'll be at home. These folks are vulnerable. They've been through a lot. A lot of their interactions with folks in the community sometimes are not the most pleasant. Sometimes people, they are out there in survival mode, and they're going to want to protect themselves first. And part of that is protecting their personal information. So when asking these questions, be careful to be sensitive and be careful with your body language and how you present, as said before. Make sure to respect that person and their situation and respect the dignity of their personhood and how they're experiencing their homelessness. They may talk about things that you may not be asking about, and that's okay. You can just remind them that this information is not required, and their sharing is as much as you appreciate their trust, the trust that they're having in you. They don't need to share, and they can if they'd like. Excuse me. Ask all the questions. Like I said before, going through this paper form, Google, important for data collection purposes. Please make sure to ask all of the questions that you can and that they're willing. Don't ask questions that you think you already know the answer, or other way around. Ask questions even if you think you already know the answer to them. You're not going to want to make assumptions about, and the key identifying point here is actually very accurate. Not assuming gender or other different aspects of the form that you're answering is essential when accurately collecting data about these folks. Somebody may present, in this instance, say they present as a masculine, as a man, masculine. They may not present or identify that way specifically on their form. So you'll want to make sure to ask the person the identifying questions about them, because this is about them and their experience, and we don't want to make assumptions about that experience. I believe that should be good. Yeah. And at the end, you can always express, thank you so much for your time and speaking with me today. If they have any specific concerns or you believe there's any resources that you know of that may be best for them, you can always reach out, make sure to give them those resources. Always ask before just giving them those resources, gaining their consent before just saying, oh, well, I think this will help you and this will help you. Of course, they've already been attached to for service stuff. And even if they're unaware of those services, nobody likes having things pushed on them. So just make sure to gain that agreement when asking and to give them those resources. And of course, resource sheets or contact cards, you can offer those. They don't have to accept it. They will, most likely. Most people do. But of course, make sure to offer that as an available solution as well.
Thank you, Owen. My name is Rob Waters. I work for the Bureau of Homeless Services. I'm the shelter administrator. And before that, I worked over in the nonprofit world on the west side of the state for Southwestern Community Services as a shelter manager, emergency housing coordinator, coordinate entry, and outreach worker. So I'm going to be discussing the observation count overview and talking about what that means for us. Next slide, please, Travis. All right, so some people might ask, what is an observation count? And what that really is, it's a it's a count where if you are seeing somebody and, like Owen had said before, if they're sleeping, if the situation feels unsafe to approach, or if they refuse an interview, you can do a observation count. So what that would look like would be tall individual, yellow jacket, in a tent behind Walmart, or middle-aged person, purple jackets, red hat, over in an abandoned building on West Street. You can utilize those type of things. That way you're not assuming gender, and you're not trying to nail down an age, and you're not trying to, assume homelessness, I guess, as well. If you fill out one of these observation counts, you're going to want to contact someone. If your agency is the one that does the outreach, or they are the regional access point, you're going to want to reconvene with your team. If they are not the regional access point or the lead outreach agency in your area, you're going to want to consult with them, because chances are they may already know who the tall person with the yellow jacket and the yellow hat behind Walmart is in the tent, could already be, and they would give them an opportunity to re-engage with them. Next slide, please, Travis. So important tips to remember: if a person has already agreed or have completed a survey, you do not need to do an observation count. The count should not be the first step taken if the individual is awake and appears safe to approach. So you always want to get the actual point in time Google Doc filled out. That's the priority. Demographic descriptors such as gender, age, race, or ethnicity should be avoided for the observation count unless the observer is engaged with the person before. So it's not uncommon for folks doing outreach to have a great conversation on a Tuesday with Mike from the abandoned building on West Street, but on Wednesday, Mike is absolutely not wanting to speak with anybody. And then Thursday, Mike might not be wanting to speak with anybody either, but Friday, Mike is totally an open book and ready to talk to everybody. So that is a great example for if you're doing the point in time count and you bump into, maybe you already know Mike, and you bump into Mike and go to say hello, and he puts the hand up and says, no, thank you, and just walks into their abandoned building. You can certainly document that you saw this person over at the abandoned building, and use the information that you previously had to try to fill out the Google Doc, or at least to do the observation count if you are someone who's like helping alongside an outreach worker. But never assume someone's identity. Next slide, please, Travis. So the re-engagement process after an observation count. Once the observation count form has been completed, again, you should be reviewing them internally to determine if the person is an existing client that the staff has familiarity or rapport with. If not, again, you should be connecting with your regional access point for further review. On a different day throughout that 7-day period that we have to reference the night of the point in time count, try to revisit the same location that the observation took place for re-engagement. Again, sometimes people just aren't having it, and it happens to be on the day. And it's a blessing for us that we get to have these 7 days to capture that that information. So make sure you utilize that time. And if you know that the person in the tent behind Walmart engages on Mondays, and that's like a thing for them, maybe re-engaging on Monday just to keep up the keep going in the right direction, and have a better chance of getting that person to do the actual point in time form would be beneficial. Next, please. So final steps. If you've successfully re-engaged, so you went back out there, you talked to the person, and you filled out the appropriate form while interviewing them, you do not submit the observation count, because their Google form will contribute to the unsheltered count. So you can shred that form. If you have not successfully re-engaged with that person, then you would submit your completed observation count. Each COC will review their respective observation counts. If the information is sufficient and deemed reliable, it will be put towards the unsheltered count. If information is deemed insufficient or not reliable, the observation will not contribute to the count. So make sure you capture as much information as you possibly can If you're doing an observation count, so when you're going back to your regional access points or the agencies that do the primary outreach in your area, they have a better idea of who they're looking for or who that might have been that you might have encountered in your journey. And also, if you re-engage and there's more notes that you can take, be sure to capture those at that time as well. Next. When submitting the observation count, the form does not guarantee contribution to the unsheltered count because the data must be complete on the form. The observed person must be one of the following. So observed sleeping in a place not meant for human habitation during the night of the point in time count or the morning after, or a client of the observing agency or regional access point that is known to be experiencing unsheltered homelessness but could not be re-engaged. So again, bridging back to your regional access point is key if you happen to do an observation count. Individuals that declined to interview or were not safe to approach during the night of the point in time count and morning after may have an observation count completed but should not be submitted. There's no way to confirm housing status in this scenario without assumption. So because of this, these cannot contribute to the unsheltered count. So story I have for that is there is a gentleman in Keene that anybody walking up the streets would assume was experiencing homelessness. They had a long beard, they had the same jacket, and they were always looking for spare change. And so if you talk to anybody, you know, in general, they would assume that that person is experiencing homelessness. However, that gentleman was housed and had a severe mental health issue, and at one point had won some sort of large sum of money on a scratch ticket. So in their mind, to continue to have income, they need to have spare change to buy scratch tickets. When we assume, if we had assumed and just done observation count and submitted it without any follow-up, we would have miscounted someone, if that had even counted at all. Next, please. I think that might be it for me. That is it for me.
All right. Hi, everybody. I'm Matt Bushy. I'm the Homeless Outreach Coordinator at the Mental Health Center of Greater Manchester. I am also on the Manchester Continuum of Care Leadership Committee and the co-chair of our outreach subcommittee. So I'll jump right in. Next slide, Travis. So where are places that we should count? Any hotspots or known locations in your community, or anywhere where we know people who are experiencing homelessness hang out or are there frequently. Communities know their communities best. I mean, I think that's one of the best lines in this whole thing. People who are experiencing homelessness know where people are staying. So it's good to ask that. I think it goes into that a little bit more later on. It's good to establish a list of teams for each location that you're going to visit. So if, and I'm sure in Manchester we have it easy, it's all just, we're only counting inside the city limits, but I'm sure when you have a number of communities to count, it can be good to have a team set up for each place, to count each town, each location you're going to go to. And then have maps. Maps are really great. Maps that have some of those locations pinned on them where you know people are going to be is really, really helpful. We use that here in Manchester when we're out doing the camp count during that week after the pit, the day of the pit. So always very helpful to have maps with locations pinned. Next slide. So some example locations where you might find people anywhere, outdoor public places, parks, bus stops are big here. Doorsteps at businesses, especially when they're closed at night. We have that a lot here. I'm sure they do in other places too. Encampments, if there's known encampments, those are places you're going to see people for sure. Parked cars. Again, with cars, though, you have to make sure that they actually are experiencing homelessness. So if the person's able to speak with you, that's always the best for people in cars. Indoor places, anywhere that's open 24 hours. If you have grocery stores or McDonald's in your area or laundromats, convenience stores are big. that are open 24 hours. People might hang out near or in them as much as they can, stay warm. Bus and train stations, anywhere you can kind of get out of the wind sometimes even is a good location. During the day, libraries and malls are certainly places where people hang out. I know most libraries are kind of, at least in larger cities like here, are definitely places where people experiencing homelessness hang out for the day, charge their phones and stuff like that. So if you anybody who you see out and about might actually know places you should go. So even if they're not someone experiencing homelessness, like people at some of those businesses that are open at night might know like where people are coming from, where they might have some good ideas of where people are staying who frequent their business. Law enforcement, certainly, if you have a good relationship with law enforcement, they're certainly going to know where they've had reports of encampments and where people hang out in parks and things. And the other, we said earlier about the community knows the community. Other people you interview might be willing to say, hey, try over at the park over there, that people hang out there. So it's always good to ask people out and about where you might see someone. So next slide. So general safety and safety basics for outreach. This is really important. You should always be with at least one other person. It's much safer that way. Certainly, we would never go out with less than two of us. And on the other end of that, try not to have groups. 3 is a good maximum size for groups, but if you need to, 4 is okay, but 3 is better. And there's really good reasons for that. It can be overwhelming to people if 4 or 5 people come up to them to try to discuss anything with them, whether it's for the pit or for any just general outreach in general. Keep an appropriate conversational distance from the people you're talking to. Just, you don't want them to feel intimidated or cornered, and also you don't really want to be too close to anyone, just for your own safety. Maintain an awareness of the space around you, where other people are, ways to get in and out of where you're visiting to talk to folks, things like that. I know for our outreach, if we have 3 people, we usually have 2 people who are maybe doing the forms with people, and then 1 person who's just there to observe what's going on around and to make sure that if you need to get out of the situation, they can say, let's go. And having a safe word is always a good idea too, so that if somebody says something, then everybody wraps up what you're doing and you leave if need be. Remain standing as much as you can. It's okay to squat down if somebody's on the ground and you need to get down at their level so they can hear you and you can hear them. That's okay, but just try to keep your balance. You don't want to get knocked over, because then you're very vulnerable if something happens. Try to stay in places that are well lit, including alleyways, but definitely have flashlights. Just be really respectful with them. Don't shine it in anyone's face, things like that. I know we had one year when we were doing our middle of the night count in Manchester, we had a volunteer who had the brightest flashlight I have ever seen and was shining it into alleyways and stuff, and had to kind of say, hey, that's, a little intrusive. So just be careful of that. Prioritize your own safety. If it doesn't feel safe approaching somebody, trust your gut. It's okay. We want people to be safe. We want the people that we're going out and talking to be safe, and we want everybody who's doing the surveys to be safe. Don't transport anyone other than volunteers in your personal vehicle for the purposes of the count, just as a general safety rule. Next slide. Health and safety of interviewees. We try to note as much as possible, try to notice if people have things that for themselves to be safe. You can ask if you have stuff to bring with you. supplies and things to bring with you, great. Ask if people have PPE or access to any hygiene products, and if you have some with you, if they need them, it's okay to give them some stuff. If try to make sure that they're wearing multiple layers of clothing to keep warm. If we see somebody who isn't, that's somebody that your outreach teams might be able to go out and bring some stuff to later on as well. So I don't know if everybody's going to be carrying, jackets and blankets and things with them, but it's nice to keep track of who needs stuff and then report it back to someone who can bring stuff out. Make sure they're dry and have winter supplies. It's hypothermia is a big concern out there. If you have water and food to bring, that's great. People love that. And it's usually needed. And then if they don't wake up, just kind of assess whether they're breathing. If you can see that they're breathing, it's always a good thing to do. And always call 911 if someone, whether yourself or someone else, is at risk of danger. That's like our lifeline. Hopefully no one will have to do that, but if need be, it's okay to do that. Please do that. And if there is a safety concern, don't attempt to continue the interview. Stop and just say, well, we're done. Thank you very much, and get out of the situation. Next. Oh, yeah. So I guess that's it for me. Thanks.
That slide right there, it's just our contact information by COC. So I just wanted to mention that too. So your respective COC reps all listed out here by email in case you want to connect with them at some point between the point in time and now. But jumping back into the presentation.
I think this is my part. So hi, everyone. I'm Robin Melchinoff. I work for the Institute for Community Alliances. We are the HMIS, or Homeless Management Information System, system administrators here in New Hampshire. So we work with all of the agencies that are entering into HMIS with their data, helping them enter data and sending reports up to HUD. I'm joined on the call today by my counterpart, also Shirtina Walker. So you might be asking, why are you presenting HMIS stuff if we're not doing HMIS? We at ICAs also help manage the Google Forms and the paper surveys as well. So we create those Google Forms and we kind of help people work through those as well. So we're going to be talking about the Google Forms and the paper surveys specifically and how those kind of look. So first, some of this might be a little redundant of what you've heard already, but not a bad thing to reiterate when it comes to the point in time. So the non-HMIS PIT count is split into two categories: sheltered, meaning emergency shelter, transitional housing, and safe haven. And then unsheltered, we're talking about, again, places not meant for human habitation, so cars, parks, sidewalks, etc. The data is going to be collected the same way using the paper forms and the Google Forms, but they're just split out between emergency shelter, transitional housing, safe haven, and then split differently between unsheltered. So data is being collected the same way, but they get combined at the end, but they're just on different forms. So for the shelter count, who to count? So sheltered people who are experiencing homelessness, we're talking about clients who are physically in a bed at an emergency shelter, safe haven, or transitional housing, specifically for people who are homeless. It can also be in a motel paid for by state funds or in a motel paid for by a charitable organization. Those will count as well. And then that data is collected for those program types. We're asking everybody to complete the survey for each individual staying in that program on the night of the point in time to gather all that required HUD data. And again, this is going to be collected via the paper surveys and the Google Forms, which we're going to take a look at here in a minute. So for the unsheltered count, again, who to count? People who are literally homeless based on the HUD definition. And we're going to talk about this a little bit more in the next slide, but we're generally counting unsheltered people who are, again, are staying in place not meant for human habitation. So things like a tent or an abandoned building or people who are on the street. So for the unsheltered count, we like to just touch base on this a little bit because it can kind of get confusing for some people year to year of who not to count for unsheltered. So this would be people who are precariously housed, if they're doubled up, if they're couch surfing, if they're staying in a motel that is not being paid for by the state or charitable organization, but say is being paid for by a family member or friend, those people we're not going to be counting for the unsheltered count. Anyone who's in a correction facility like jail, prison, or DOC transitional housing, foster care or group placement homes, if they're not dedicated specifically to serving homeless individuals, we don't want to be counting them. Mental health, so anything like state hospitals or equivalents, subsidy programs, mental health crisis or group homes, we won't be counting those individuals. And then again, other healthcare like hospitals, nursing facilities, assisted living, substance use treatment, or any of those types of facilities, they have technically a roof over their head and they're not counted for the PIT count via HUD rules. So how is that data collected? You've heard all of us talk about the Google forms and the paper surveys, so now we're finally going to be able to dive into those. The paper survey and the Google forms are both used, and there is an extended window of time, which we talked about earlier in this presentation as well. You may collect that data for up to 7 days after the PIT. So again, if you need a couple extra days to reapproach someone and get that data collected, you definitely have the time to do that. The raw data that's provided to us at ICA after we get all of the information from the Google forms, we then take that data and we take the HMIS data and we combine them together. We meet with the COC leads for this because they just generally tend to know about what's going on in their communities better than we do. So we meet with the COC leads, we take all the data, we combine that, and then we deduplicate it the best we can, and then we kind of wrap it up in a neat little package and we send it on up to HUD. So that's how we merge the HMIS and the non-HMIS data to get one complete count for the point in time. So this is just a quick look at the paper survey. The paper survey is used to collect data out in the field. This is used a lot if you don't have a tablet or a phone or a way to connect onto the Google Forms. And so this is kind of what it looks like. It gives you a little breakdown here and a little verbiage for you to tell the client why you're collecting this data, and ask for, again, where were you sleeping on the night of the point in time? Was it an emergency shelter, transitional housing? Were you unsheltered? And then the next section down does go through their household information. So again, we're not asking too much of them, their full name, their middle name, any in-depth information, but we do try to ask for the first letter of their first name and a couple of other things so that we can kind of narrow down when we're looking at the Google Forms to do that deduplication and to get it submitted to HUD. So you're asking this information for their household members and then also things like their disability. So again, there's a nice little section at the top that kind of goes over, like, none of this is your date of birth, your personal information. We're not going to send this data specifically to any federal or state entities. It's all going to be aggregated data, but we do need to collect it enough data on our end so that we can do that deduplication and put it all together. Another important thing to note here is that all the data on the survey is required to be collected. Unfortunately, HUD does not allow for missing data for the point in time. This is not an ICA rule or a state rule, it's a HUD rule. So while, like Owen was saying and Rob was saying, we want to make sure that we're respecting the folks that we're talking to, and we're not pushing and we're not trying to get information out of them that they don't want to provide. But at the end of the day, unfortunately, that data does need to be submitted somehow. So for example, things like race, if a client doesn't want to give you their race, that's okay, but we do have to put them in some kind of category for race and all of these other categories. So unfortunately, what needs to happen in that case is that we at ICA will have to work with the COC leads and we'll have to make a decision about what race category to put them in. And because we live in New Hampshire and we're primarily a state that is white, we tend to have to put them in a white category. So we don't like to do that. It makes us uncomfortable. We know that it makes you all uncomfortable, but unfortunately, for whatever reason, HUD mandates that all that data is collected. So we don't want to be pushing anybody for data, but also just keep in the back of your head that we do have to have as much data as we can possibly have, because HUD does not allow for any missing data. So finally, here we are at the Google Forms. This is where all of our data is ultimately going to get entered into. Again, if you're using those paper surveys when you're out in the field, ultimately you'll have to come back to the Google Forms and transfer all that data into the Google Forms. So the two of them match what information you need to be providing. And at the end of the day, this is where we're going to take the data and get to bring to HUD. So ICA creates the Google form to match that paper survey. And then we have our Google Forms. This is just kind of a brief look at what they are. The Google Forms are on our ICA website, which I linked at my last slide here. So they can be found there. We have live links that will go live in the next couple of days. And then we also have demo links on there that are up there now. So those are really for if you've never done the point in time, or if you did the point in time last year, but you can't remember what the Google Forms look like or how to do them or what needs to be put into them, you can kind of go on our website and use the demo links and just play around with them. We ask that you do not add any live data into the demo links, but they're there really for you just to take a look at and practice if you want to do that in the next week before the point in time happens, just so you can kind of prepare for what you're going to be looking at. So all of that is on our ICA website, which I have linked here. But if you need the links to that, we can provide those to you. Just send us an email via the help desk. I'm sure Travis and Rob and Mandy are all happy to provide that link for you too if you need it. But all the guides and everything we need are on our website too, along with the Google Forms. So this is the timeline that we're looking at here. Thursday, January 23rd, which is the day after the point in time, is when you want to start collecting that data. And then if you have that data right away, you can enter it into the Google Forms. This Thursday, January 30th date, that's just kind of a date that we like to give just to say, hey, if you haven't gotten your data in yet, you haven't started entering into those Google Forms, you might want to start that process now so that you can get it in and ensure that it's all there before that final due date. If you have your point in time data and you are ready to go to enter into those Google Forms the very next day or the day after, please do that. We would love to have it entered as soon as possible. So feel free to enter it as soon as you know that it's accurate and correct and you have everything you need. But again, that Thursday is about a week after the point in time. If you've had to go back and kind of revisit some folks to ask them more questions or get more data or get more information from them, now you've passed that 7-day mark. This is when you want to start getting it into the Google Forms. And then Thursday, February 26th, that's our hard deadline. That's the day that we really need you to have all of that data into the Google Forms. I believe that we tend to close them out maybe like end of day on that day, or perhaps very early the next day. So that's the hard deadline of getting your data into those Google Forms, because we then end up closing them out just to make sure that we don't have any extra data that we don't need. So that's the timeline. Again, that's also posted on our ICA website. So if you need a reminder of what those dates are, it's going to be up there as well. And here it is, the ICA website. So this is our knowledge base. We have a whole point in time knowledge base article. We have lots of guides for you all to use. We have the timeline up there. Once this training is done, I'll have Travis send me that link and I can post it to our website as well, so that you'll have that on there. And then again, the Google form links will be on our website and the demo links will also be on that website. So it's a nifty little article where you can find everything you need that has to do with the Google form, or the paper surveys will be on there for you, and just some other resources that might help as you're going along. And then our contact is there. The New Hampshire Help Desk is the best way to contact us if you need to. That's a way for me to be able to see it, for Shirtina to be able to see it, for our supervisor in case one of us is out. Someone will be able to see your email and get back to you. So that's the easiest way to contact us. And I think that's all I got. Thank you.